Welcome everyone for joining us to our August monthly webinar for weight loss surgery in Mexico with Mexico Bariatric Center. I have the pleasure to have Dr. Montalvo from Hospital Azar to join us. Hello, Dr. Montalvo. How are you? Good to see you. Again, please make sure you have submitted a health questionnaire and watch the webinar to the end and do the Zoom poll to be eligible to enter the $2,000 off of raffle of the surgery. Just a little bit about myself. My name is Ron Elli. I'm the founder of Mexico Bariatric Center and Hospital Azar. And I've been in the medical tourism industry since 2007. I have traveled all over Mexico and have connection with all the medical, and clinical people and hospital facilities all over Mexico, Monterrey, Cancun, Guadalajara, Puerto Vallarta. Tijuana is our main hub right now. We have been focusing on Tijuana a lot because it's just so close to the border to US, and the way we have the talent that has gathered in that in Tijuana is amazing. Tijuana has transformed itself and is not the border city that used to be. If you travel now, you see the high rises going everywhere. As a matter of fact, we stay in Hyatt Place in Tijuana, which is one of the top hotels in Tijuana right now. But there is a West End going, and they're going to be like over 20 stories high. And I mean, there's so many high rises. Our own building that we did the Hospital Azar in, that's a brand new building. So there is so much going on in Tijuana. Just a little bit about Hospital Azar updates. We will go over that soon about the facilities, but we always have news as far as what we're offering. We've been offering gynecological treatments, procedure, laparoscopic, like endometriosis, hysterectomy, and we always have new procedures like SASSY. Dr. Jackie is offering what we call Get Sassy with Sassy, which is a duodenal switch, but is a little less invasive, more effective than normal SATI. But Dr. Montalvo is going to touch base on those. And so you always need to, we're always offering new services. We are going to actually have a seminar in New Zealand in November 21st, 22nd, 23rd. So we always have news we used to go to seminars, actual seminars in US and Canada. And but after COVID, we started doing more webinars, but now we're going to travel more to different locations. And then our blog posts is always have exciting and new articles that you can get informed about, whether it's diet related or weight loss related. We also started offering orthoscopic surgery, which we're going to go over, which is knee replacement, hip replacement. We're doing all that too in the Hospital Azar. Now, we try to cover all the questions that you may have during the presentation. Please pay attention. If you didn't hear the answer to your concerns or your questions, you can always ask us at the end in the Q&A tab. Okay, so topics that myself and Dr. Montalvo is going to cover today is I talk about obesity a little bit, about the risks, show you how to calculate your weight loss and your ideal or goal weight. Dr. Montalvo, he would talk about, I'm talking about weight loss surgery and why MBC, and then the different ways that we support patients pre-op and post-op. Dr. Montalvo at that time is going to talk about all of our laparoscopic, endoscopic procedures, revisional, all that we offer. We offer a wide range of procedures that patients can take advantage of, whether you had a surgery before or is your first time. We talk about financing. We would touch base on MTI, which is medical tourism insurance. That's a great feature that we offer at affordable prices. And we talk about nutritional program we have, and we then at that time I'm going to go live with the Zoom poll. Please make sure you do that, and then Q&A. Once we finish, we do the wrap. We all know what obesity is. Basically, is a multifactorial disease that continues to grow among teenagers, adults in US, everywhere in the world. And statistics keep showing that this problem is just getting worse. And in the medical field, it's just a formula that's called BMI or body mass index that determines where you in this chart. If you're below 25, normal, 25 to 30 is overweight, 30 and above is obese, morbidly obese, super morbidly obese, super morbidly obese, and it goes on and on. Of course, we will see that the BMI is not really exact, but that's just one way to first gauge you where you are. The way our body is built, our bones, being female or male, all this determines the obesity factor. Our center approves patients that are above 30 and above BMI, but there are special cases that our surgeons, either based on procedure or based on your comorbidities, that we can take patients under 30, maybe 28, 29, and you will see the criteria. I talked about how to calculate your ideal or goal weight. Okay, so it's very simple. There is a chart that shows based on height and frame size and sex, what is the ideal weight. Okay, so a lady with a 5'4" with a mid-size frame should be around 120 pounds. So if this person weighs 220, they have 100 pounds of extra weight. In average, we say about 70 to 75%, for example, you lose of your percentage of your expected weight loss, of your excess weight loss. So you're going to lose about 70 pounds. But then again, that's just average. We'll see. Our patients usually lose all the weight that they want. And after surgery, you're going to weigh about 140 or 150. And of course, the ideal could be different from your goal weight. Some people, don't mind having a little extra pounds, but it takes you to where you want to be. And this is how you calculate if you want to be exact. Also, there are factors like age, right? So as you see, ideal weight should be lower. So when we say these are just average, this is what we mean, right? It depends on the body type, it depends on the age, it depends on so many factors. So the factors that contribute to obesity, we all know, right? The increased nutrient content of food we eat, like fast food, lack of physical activity, that's huge. stress eating, inadequate sleep, we're used to large meals, and sugary drinks, right? Our body is not used to this high-calorie, ultra-processed food. And what happens is not only the fat cells or adipose tissues increase in numbers, they increase in size, and the structural changes happen, which, as you see the adipose tissue or fat cells between a lean person versus an obese person, you see how it's different. And this difference is causing all the problems that come. Yeah, I was just reading an article about 3 days ago that there is a direct link between obesity and colon cancer. Because before they would say, yes, it would cause cancer among all the other problems, but now they're finding direct links. So we have bad bacteria and good bacteria in our guts and our intestinal tract. And when we eat sugary drinks and low fiber food, that increases, it doesn't feed the good bacteria, and the bad bacteria grows, and bad bacteria cause cancer. Very simple. And then all the problems that come with it, insulin insensitivity, leptin insensitivity, which means diabetes type 2. We don't ever, get satiety from what we eat. And even our muscles don't respond to protein and exercise. This is a condition that happens when we age, but with obesity, this condition happens, which means when you take protein and you exercise, your muscles not going to respond. So there's so many problems with this structural change of adipose tissue. And again, is a major risk factor. In US alone, 40%, over 40% of adults are dealing with this obesity problem. And it's a disease, heart disease, stroke, diabetes type 2, we talked about, lung disease. Everything happens. Your body gets under pressure, your blood vessels under pressure, everything is under pressure. Your immune system gets affected. During COVID, we realized that even was a problem, obesity was a problem during COVID, right? There were more fat cells, more places for coronavirus to attach itself to these fat cells, and more chance of catching it, ending up in a hospital, and actually dying. And that's why, after COVID, we started thinking like, okay, we need to have a healthy life. We need to lose weight. But then again, life is busy. We go through life trying to make it day to day. We lose focus of our well-being, and this is what's happening, right? Again, what is the cure for obesity? Okay, diet and exercise. Doesn't mean that even if you get the surgery, you don't need to have good diet and be active and do exercise. But obesity, diet and exercise is not a proven long-term solution for obesity, not for everyone. You see, there is a pyramid I'm going to show you later on. And it comes the magic pills. From the beginning of human history, civilization, we have tried to find a magic pill that we take and we will lose weight. But there is no such a thing. And you see, okay, Ozempic type of medications are great, but we will see. So at this point, still, if you look at, it was an article just published not even a month ago in the Journal of ASMBS that showed that bariatrics is the definitive solution for proven long-term and quick, safe, and long-term solution for obesity. So this is still the high standard solution to lose weight and keep it off, right? Is a gold standard. This is a good way of looking at it when we go on diet and we exercise to lose weight, you know, is like to get to your goal weight, you have to fight with your metabolism and your hunger. And we'll see why, because this is explained here, what we call a metabolic system, right? We all have a metabolic system or a set point. Let's say if I'm at 250 pounds, my body, my brain, and my gut hormones are interacting around that weight. And I'm used to that. My body doesn't want to change because it's used to that. It wants to keep me at that weight. So even if I do boot camp type of exercise and go on an extreme diet and manage to lose 75 pounds, it is possible. It takes a lot of effort. Still, my body wants to pull me back to my 250 set point because that's my set point for metabolic system. Now, when you do bariatric surgery actually resets our metabolic system. We call it metabolic system calibration. So the minute you wake up from the surgery, you see yourself at a lower set point. And what happens is your hunger goes down and your metabolism goes up. And that's a magic, right? That's a magic about bariatric surgery because it changes your hormones. And we're going to see like how this Ozempic type of medication trying to imitate the effects of bariatric surgery. Look, on the right side, you see the known, these are only the known hormones that are changed due to the bariatric surgery. So when you get up from the surgery, when you wake up, these are all changed in your system. Now, what is the pharmaceutical is trying to do is they trying to create, you've heard of GLP-1 type of medication. GLP-1 is one of the hormones that changes naturally as a result of surgery, but you have to inject the synthetic one in your body, and then there is a newer one like Manjaro that has other components like GIP, but still you see there's only two hormones. And here's the problem. You have to keep injecting or taking the medication. There is a pill coming soon. I don't know if it's approved or not yet, but you have to keep taking it. If you stop, you're going to go back and more. So, and then now they're finding out, well, I mean, Manjaro or Zepbound, these are all different, names for the same medications. So there is two different ones, semaglutide. And so what are the side effects? From vision problem to muscle loss problem to kidney problem. If you have thyroid problems, you can't even take it because it can create thyroid tumors. And right now they're saying 12% of people regain the weight in 12 months. This is the statistics just published. 70% of people who start the injection, they stop after 1 year. The stomach issues, it starts to lose its effect. Also the inconvenience and the price, the cost. Okay, so I promised to show you the pyramid, right? So if you put the effectiveness of different option for weight loss, right? Diet and exercise is still is great, but only works for a small portion of population. And then it comes semaglutide injections, like Wegovy, Mounjaro, we talked about, only works for a small portion. I mean, these type of medications are breakthrough, is miracle, is no doubt about it. But to get to that ideal weight, you need a more effective tool, okay? Then it becomes endoscopic procedures. Are endoscopic procedures are effective? Yes, but only for a small portion of population. Why is that? Because you need to have the discipline. It doesn't change your hormones, but we'll see. Dr. Montalvo is going to explain about that. And then the gold standard, which is gastric sleeve, bypass, duodenal switch, SASI, SADI, all those procedures that we're going to discuss. Now, the cost and the availability of this great tool becomes a problem, right? So we want to cure obesity. Bariatric surgery is the option. Now, does your insurance cover? Or the out-of-pocket deductibles are more than our $4,000 package. Or they run you through so many hoops that you finally say, you know what, I'm done with this. And you come to us, right? So medical tourism is the answer. We offer not only affordable, it's a specialized care, VIP treatment with the top surgeons that you get the surgery from. And who is the best one to go to? Even CDC suggests or recommends to go with companies like NBC. Why? Because we screen the facility, we screen the doctors, the surgeons, we provide all the movement from the transportation to hotel reservation. We're like re-regulating the industry. We are a second eye on your travel. We have everything arranged for you. And then you see a list of things that why you go with MBC. But like, for example, we offer medical tourism insurance, which covers up to 45 days after surgery for $99. Imagine the stuff that you get by going with us. You know, and as I mentioned, Tijuana is offering one of the best packages, one of the best specialized doctors in the facilities. I mean, Hospital Azar. We've been only open maybe 9 months. Our reputation has spread all over the place. I was just talking to a surgeon the other day from Guadalajara, and he said, yes, I have heard about Hospital Azar. That's amazing to me. This is the kind of services you're getting at a very low prices. NBC has been in business since 2012, and we are a US-based corporation. Actually, I'm in the main office in Sacramento talking to you. As I mentioned, Dr. Montalvo is in our Hospital Azar in Tijuana. We work with 5 top quality bariatric surgical teams. They're not like one team, 5 surgeons. They all have their individual teams. And when you go there and you see, wow, there's so many patients, remember, we have 5 team of surgeons every day working. And we limit their surgeries, you'll see. We have done over 28,000 surgeries. And these are not just, we're not just publishing these numbers. These are not fake numbers, okay? And we've been doing this for over 13 years. I mean, if you look at our reviews, online. If you look at our videos from past patients, we're not just some fake social media, Instagram, funny or attractive, video, a little cute 30-second video. We have a backing of the staff that work here in US and the staff that are working with the surgical team. I counted at one time, we have about 250 people working, not all in the MBC, but like from transportation, surgical teams, hospital, MBC in US. We're about 250 people working for every patient that goes down and come back. So you see the depth of the company. We know what we're doing because we've been doing it for so long. Our complication rates is one of the lowest, and our success rate is one of the highest. So one of the reasons we are so successful because we manage the load per day per surgeon. So based on the complexity, we don't give them too much so they don't get exhausted. And our surgeons are not, they're actually doing their own surgery. They're not just a name, Let's say Dr. Montalvo, he's been doing this for so many years, but he still is the lead surgeon going into the OR and doing the surgery. We see this often because I travel there all the time. I've been in the industry so many years. I see the surgeon actually walk into the hospital when the surgery already started, or they jump from this OR to the other OR. They have simultaneous surgeries going on. So the surgeon that you sign up for, if it's very well known, doesn't mean he's the surgeon that is doing the surgery. But I promise you, every surgeon that we have, they are well known, but they do the surgery themselves. And they all have at least, the least amount of surgeries they've done is 5,000. So they're not some assistant surgeon that just started their practice and they're lowering the price and they're putting some TikTok cute video up there to attract people, and there is no back into it. It's like, who's running the company? Who's behind all this? Well, me, I'm always around. They see me down there in the hospital. They see me up here. We're not some unknown kind of a obscure company that we just have a cute website and a cute social media. No. And then there's a difference between an assistant surgeon and an experienced surgeon. Yeah, most of the time, nothing bad happens. But when you need that experience is when that life is on the line. It's like a difference between a pilot that only has 200 hours of flight and a pilot that 10,000 hours of flight with 10 years of experience. You see that often how the experienced pilot has saved the life of people in the plane. So it's huge. I was just reading, not to get off the tangent, about the plane that crashed in India. This plane, they say the reason that crashed is because the fuel line to the engine was shut down and then shut back and then turned back on, but it wasn't. So one mistake of the surgeon can cause people's lives. So you want to give your life to a surgeon that is experienced with the experienced team. I promise you, the team of Dr., for example, we're just talking about Dr. Montalvo. His team, his anesthesiologist, his assistant, his instrumentation, his nurse have been working in the same team for years. They're the best in the industry. You cannot get better surgeons than these people. So yes, you're coming because your insurance doesn't cover or you want to save money. But this is not about saving money anymore. We're offering services that no one even in the US touches. So you're getting the best care for the best prices. Again, I talked about the social media. Social media is great, but make sure when you see those Instagram or TikTok or Facebook ads, who is behind it? Are they trusted organization? Is it just one assistant surgeon? I would just like, oh, I just started my company and I'm lowering the prices to get people. Here's, we talk about Hospital Azar. Let me play this video for you, and then we're gonna go over it. Say it to you, they don't most think about it. Fifteen of September, lighting up with our people. Never too late, forget the magic, So I worked on this project, Hospital Azar, since 2021, and we finally managed to become operational last year in September. The name is actually tribute to my mother, who passed away last year. This center has 4 operating rooms, state of the art. We are in Tijuana right now, #1 for our facilities, for our equipment, for our advanced operating room that we have, sterilization that we have. Everything we're doing is top of the line. We actually get requests to do sterilization for these top hospitals that are JCI in Tijuana. And we have 40 rooms. I mean, every room has view of Tijuana. It's amazing. I was just there last week when we had a plastic patient that came with his cousin, and he was saying that keep telling my cousin, keep the curtains up, keep the curtains up, so I can see the view. I mean, you see that's behind. Actually, that's one of our administration offices in Tijuana. You see, I mean, it's amazing. Actually, I have other views that I think I like more, but that's a great view from what you see. So this is not just some photoshopped pictures or videos. They're real. People understand. And we made this hospital kind of thinking that it would be, the capacity would be enough for us. But honestly, with the trend has been going, the requests and for plastics and bariatrics we've been getting, soon we could run out of space. And I was just thinking the other day, it's like, do I want to start another project, bigger project? So that is another thing we can discuss. But yeah, so that's a good challenge to have. Their demand is high right now for us because they don't understand that this is like, for example, this is a picture of a recovery rooms, and you know okay, so after COVID, we started not taking companion, stay in the hospital with the patient, but finally we opened it up this year, so companions can stay with their patient if they choose to. Of course, they're not going to have a bed or anything, it's just a recliner. But I understand, it's your loved one that you want to stay with. That's fine, but you do have option to stay behind. So first night you arrive, after the surgery, the companion can stay in the hotel or in the hospital. Our process is very simple. Step 1, 2, 3. You fill out the health questionnaire. You choose the date. You get your approval. After you get your approval, actually, you can book yourself by finding a date that works for you and the surgeon and put a deposit. You're official now. The remaining balance is due 14 days prior to the surgery. Whether you bring a cashier check, you can send a picture of it and then bring it with you. However you want to pay, it has to be paid or be known to us. How are you going to pay? And then whether you drive or you fly, you basically tell us your itinerary and finish your paperwork and you're done. These are our all-inclusive packages. What it covers, of course, the medical tourism insurance, like I mentioned, is extra, $99, but you can see the packages that we offer. I do recommend that because we're getting more and more busy, you act, if you want to go sooner, to act faster so you get the spot that you want. Like I said, our surgeons have limited number of openings every day. It's not like we give them 6, 7, 10, 15. As I told you, I mean, I'm not going to name companies, but I see that some surgeons doing 10, 15 surgeries a day. Of course, they're jumping from this OR to that OR, but hey, it's a human being. After so many hours, you get tired, there's more chance of making mistakes. So these are all the facts that you want to pay attention to. Our support group, as I mentioned, we have great support pre-op and post-op. Our main support group is 13,000 over past plus of past patients. Here's the something. I see some of these other competitors that have, I don't know, thousands of members. But remember, we don't open our main group to anybody but the past patients for your privacy. We have other groups. We have one we call Inside Facebook, which is the people who are coming on board. They're not sure. They fill out the health questionnaire. They want to know what it's like to have surgery. What's like to have surgery with us? That's few thousand patients. But the main group, I want to emphasize, we don't allow anybody except past patients to join. That's huge because your privacy is important to us. We can open that to people and it would be like 65,000 all of a sudden, but we don't do that. We do have a bunch of events. For example, the webinars we do every month, beginning of the month, Saturday, but then this time because of 4th of July, we moved it 1 week past. The surgeon QA every Wednesday, 10 to 10:30 Pacific time. One of our surgeons are online answering questions. Our coordinators go live, our nutritionists go live. There's so many opportunities to get online. So I was talking about the depth of the company, okay? And actually, we hired one more. Taylor is not even here. We have coordinators in Canada, Anna in Canada, Vanessa in New Zealand, Tiffany is doing our plastics. Tiffany is our own patient. These are all our past patients. They are so believing in the company that they're working for us day in, day out. This is the kind of, we're not talking about our US staff or the one that are in the hub. These are just past patients. This is the support you're getting from NBC. We do have a podcast between Rena and Sarita. Sarita is actually more active in the Facebook, and they've been like, for example, Kelly, she's been a past patient for bariatrics, plastics. These people are committed with us to support patients because they know what it takes for transforming your life and going down there for doing that. Um, I see a lot of people joined us later. To be eligible for the $2,000 off of surgery raffle, you need to have a HQ in our system, health questionnaire, and fill out the Zoom pool and be attentive and attend to the end of the webinar. Another success, right? We talked about 5 teams, individual teams, independent teams of surgical behalf. Dr. Montalvo, that we have in a pleasure to have him today, Alejandro Gutierrez, our chief surgeon, Rodriguez Lopez, Jacqueline Osuna, we call him Dr. Jackie, Dr. Jesus Sea. Dr. Jacqueline Osuna, for example, she's been at least working with me since 2010. I know her from that time. These are like, she works in one of the top centers in Guadalajara. She's actually a teacher teaching all these new surgeons about general surgery, bariatrics. This is the kind of caliber people working with us. And then this is the process. When you submit a health questionnaire, this is what we do with your health questionnaire. First of all, we have developed over years complex routines and algorithm that takes your information and find out what's the best match for you. And then based on the type of surgery, based on your condition, your BMI, all that comes into account. We connect you, if you don't select a surgeon, with the best surgeon that fits for you. And then our surgeon liaison, Jen, which is actually an American doctor that studied in Guadalajara and been with us over 8 years doing this, is watching every HQ going back and forth. Okay, so this is the back end of what we do with your health questionnaire. And we don't sell your information. We don't remarket the leads. So you end up getting a bunch of emails and phone calls from other companies. This is your privacy is our prime concern. You know, how many times a day you get calls or email when you submit some form to some company because they sell your information to make more money. That's how they make money. Yes, they can give you the surgery for cheap, but then they make money on the other end. We don't do any of this stuff. We use Hyatt Place, like I mentioned, is one of the best hotels right now, most in demand because of their service, because of the facility in Tijuana. Just a little bit touch base on the pre-op diet. Pre-op diet is very simple based on your BMI. It could be from few weeks to only 2-day clear liquid. But please, please, please do a good job on your pre-op diet. Low carb, high protein, low calorie per day. Just take protein drinks. It's not very difficult. It shows your commitment to this process. Remember, weight loss surgery is just a tool that you acquire, right? You have to work with the tool to be successful. It's not like a done deal. Okay, I got the surgery. I'm not going to move anymore. I'm going to just take milkshake all day. That doesn't work like that. We need to work with the tool to get to the ideal weight, okay? And that's why people like Sarita, she's had surgery since 2015. And look at her now. She posts her pictures. She had sleeve. She looks great because she keeps working with the tool, okay? And the pre-op diet, the better you do, the easier surgery for you and the surgeon. It's easier post-op recovery. It's less inflammation. Your liver shrinks. There's so many good things about that. So please take it seriously. We will tell you what medications to stop or start before and after, but in general, if you're on Ozempic type of medication, stop 3 weeks before. Blood thinners, NSAID 1 week before. These are just general instruction. Okay, bring your bottles, your medication bottles, if you're taking something on a regular basis, to Tijuana. Okay, so whether you fly or drive, our drivers meet you at the San Diego International Airport. There are 2 terminals. Southwest goes to Terminal 1, which is under construction. Soon they will be releasing the new airport terminal, which is beautiful. It's been a mess for past few years. It's very simple. Right now, when you enter Southwest, you just come down, get your luggage. Please pack light, maybe 1 small suitcase. You don't need a lot of stuff. Okay, the weather is not like drastic cold or hot in San Diego, because Tijuana is right next to San Diego. Okay, so you're getting the San Diego weather. So you don't need to pack a lot of stuff, and just bring clean clothes so you can change after surgery. We want you to arrive before 12 and depart after 2. Something I forgot to say is about Terminal 2. Terminal 2 is Delta, United, all those guys. That's a newer terminal. Again, you do the same. You come down. If you checked in your luggage or if you had a carry-on, just come down. Driver is expecting you. Go to the sidewalk. The sidewalk has a letter from A to F, and then you tell the driver the driver calls you the day before your departure, and they know you're coming. So you just tell them, like, I'm on a letter of such and such. They come and pick you up. That's it. You're on your way. They take you to our facilities. You do the pre-ops. And whether you stay in the hospital or hotel, they take you there. The next day, they take you to the OR, the time that is designated. And again, you stay in the hospital 2-3 nights based on your procedure. If you're plastic, you stay longer, of course. Your departure should be around 2 p.m. This way, we have enough time to cross you. Now, if these times don't match, you can either stay on the San Diego side or Tijuana side based on your departure or arrival. We can arrange your stay more in Tijuana. If not, there are options like Hampton Inn, other places that they give you special rates. I'm sorry, if you mention our name. And so the day you arrive, basically, we offer broth, jello, ice chips before and after surgery. Relax, whether you're in a hotel or hospital. Your companion stay behind. If they stay behind, they get free breakfast in the hotel. Of course, it's more comfortable. This is the team of Dr. Montalvo. And you go through the surgery, you stay there. We do the leak test. We do all that we have to do. You're on your way to go back, okay? If you have long travel time, you can stay maybe longer down there. If not, please make sure you get up and walk around in the plane every hour. Make sure you wear compression socks and all that. Our post-op diet, again, is very simple. We send you all this information. Again, there are webinars you can get on with the nutritionists we have in-house, and they will train you. Sorry. So it goes from clear liquid to solid in 4 weeks. Okay, so we talked about the average weight loss percentage. This is the weight loss from our patients. Look at the gastric sleeve. Our average patient weight loss is 74% in 18 months. You still lose weight until 2 years. So the published data shows you 65% to 75%. Our average is above the published data. Same thing for bypass, same thing for mini bypass, and same thing for duodenal switch. And we talked about revision. Only less than 5% of patients need a reoperation because of not losing enough weight to get to the goal weight, or they need some kind of revision because they get acid reflux or something like that. Average published in US is 15%. You know how we were talking about low complication, high success rate? This data shows our success rate. Okay, so Dr. Montalvo, I'm gonna just say, I mean, he's a well-known surgeon. He's a world-renowned surgeon. I don't need to explain so much. He's in high demand. He's done at least, this is old data, at least 6,000 surgeries. He's one of the best scholars I know in Tijuana. His team himself are out of this world, if I can say. And I'm going to let him take over and explain all the procedures we offer, and then I take over. Thank you so much, Dr. Montalvo.
Hi, hello to everyone. Good morning. Okay, let's talk about all of the options that our patients can have. Obviously, we perform here at Mexico Bariatric Center all the kind of surgeries. It will depend of what kind of your medical conditions. That's why it's very important to put all the information on your HQ so we can make a recommendation for which kind of procedure will be the best for you. We have laparoscopic and endoscopic procedures. Obviously the sleeve is the most common surgery performed in the world. We have all the bypasses, the mini bypass, the duodenal switch, endoscopic procedure like the gastric balloon or the endoscopic sleeve gastrectomy or the endoscopic bypass revisions. Talking about the reinforced gastric sleeve surgery, this is in this kind of procedure, the gastric sleeve surgery removes approximately like 80-85% of the stomach, since 1 to 5 tiny incisions used by laparoscopic. The size of the boogie that we use is 34 or 36 French. And these procedures utilize restriction to limit the food intake, change the gut hormones, cause hunger and satiety, like the ghrelin hormone, and slows the gastric emptying. So what to expect here? To decrease the level of ghrelin, that is the hunger hormone, to increase the level of GLP-1 and increase the levels of PYY, and no changes in the G1P. The process can be easily revised if needed. Like Ron already said, only less of 5% of all the patients can have, at least with us, a revision. Obviously, it will depend that you follow the indications, the post-op indications, like doing any kind of exercise and follow a nutrition plan. Other of the process, a high amount of excess weight loss comparable. Resolution of comorbidities like the diabetes, like the hypertension, cholesterol, arthritis, PCOS. No changes here with the anatomy and less malabsorption, because here only we cut the stomach, but all the intestinal tract is we don't make any changes over there. short recovery time. The cons here can, on a pre-existing acid reflux or GERD, can be worse, and it's not reversible. The duration of the surgery will depend 30, 45 minutes or 1 hour. You will be here at the hospital 2 nights, and the recovery will depend what kind of activity you do. So it can be from 1 to 3 weeks. Okay, the next. Okay, talking about the single incision gastric sleeve, or also called seals. Here, the surgery is performed through one opening roughly 1.5 inches with the umbilical or navel area, hiding inside the belly button so the abdominal looks scar-free. Any drain tubes are removed. The expectations is like the same of the gastric sleeve. Decrease the level of ghrelin, increase the level of GLP-1, PYY, no changes in the gastrointestinal. Same results as the BSG. The pros is going to be the same. Only here is an aesthetic approach. And the cons can be the GERD or the acid reflux can be worse. The BMI here, it need to be less than 40. And the recovery will be the same. Well, from what kind of activity you do, from 1 to 3 weeks. And the duration is 1 hour, 1 hour and 30 minutes. Okay, next, please.
Did you already talk about ESG or?
Yes.
Okay.
All right, talking about the bypass, here the RNY, the RNY is a classic bypass, was the first surgery and was the gold standard in the past years. That has, you already, you put attention in the previous pictures. The the weight loss, it will depend from 80-85% of weight loss. Here in this kind of bypass or the classic bypass or RNY, here the surgery forms a new stomach pouch while the remaining stomach stay in the place. And the small intestines are rerouted by bypass food digestion, which create malabsorptions and reduce the calorie intake. So the expectations here is only slight decrease in the ghrelin. Why? Because the ghrelin is on the fundus. So in sometimes we don't remove the remain stomach. So there will be some ghrelin on your body. Will be the increase the levels of GLP-1 and PYY and decrease the GL1P, and especially in diabetic patients. So what's the gold standard in the RNY? High amount of excess of weight loss, improved obesity-related comorbidity like diabetes, high blood pressure, sleep apnea. And here, one of the cons are the chance of vomit or dumping syndrome and high risk of ulcers. Here, the duration can be approximately like 2 hours of surgery, and you the recovery will depend 10 days or 4 weeks. It will depend on what kind of activity you do. Okay, what's the best surgery for the patient? Obviously, it will depend of your characteristics of your medical conditions. That's why it's very important to put all the information on your HQ so we can make a recommendation. All right. Both of them are great. Only it will depend if you have a previous bariatric procedure, if you have severe reflux, any other abdominal surgery. In patients with severe reflux, the best procedure will be a bypass. Patients who don't have any previous abdominal procedures or bariatric procedures, not to hide the BMI. It will depend. Some patients, the best will be a gastric sleeve, to start with a gastric sleeve with your weight loss journey. So that's why it's very important to put the information on your HQ. The mini bypass. The mini bypass, or also called OHGB, or the one anastomosis bypass. Here on the mini bypass, we debase the upper portion of the stomach to a tube like a pouch, which holds only 4 to 6 ounces of food. The intestine is looped to connect the new stomach to decrease the amount of calories that you absorb. Approximately, we exclude like 2 meters of your small intestine. So that 2 meters is not going to function anymore. They're not going to absorb the nutrients in that portion. So that's why it's very important to take your vitamins, your protein in this kind of patients. The expectation is to reduce the feeling of hunger to the altered gut, early satiety or feeling full after small portions, reduce the calories and nutrients absorbed, and resolve comorbidity like diabetes, hypertension, cholesterol. The pros is only a single anastomosis or connection to the intestine. It's safe, effective, and shorter procedure than the standard RNY or classic bypass. It's one of the most effective surgeries to reverse failed gastric sleeve or lab band. Chance of vomit and dumping syndrome, high of ulcers, and change of bile reflux. The duration is approximately like 2 hours, and you will stay 3 days 3 nights at hospital, and the recovery will depend 2 to 4 weeks. Okay, what's the best surgery between both bypasses? The weight loss on both of them will be almost the same, okay? Because the connection or the anastomosis that we perform on both of them is the same. It's excluding 2 meters of the small intestine, and that's not going to absorb anymore. Obviously, on both of them, can be some marginal ulcerations, the internal hernias. Obviously, in the mini bypass, the duration is less because it's less connections. We're talking about 2 hours. The RNY is more for patients with severe reflux, with not controlled diabetes, or other conditions, previous procedures. Okay, talking about the Duodenal Switch or a SASI, it's a single anastomosis stomach ileal with a sleeve. As you see here in this picture, we perform a gastric sleeve and a connection in the small intestine with the sleeve. Here is a new procedure that combines the gastric sleeve and the mini bypass benefits while reducing the nutritional risk. It preserves the natural digestions, lowering deficiency risk beyond restrictions, SASI harness hormonal shifts, and gut microbiome change for metabolic benefits. Expectations here, the patient lost between 65–75% of excessive weight in the first year. High percentage of duodenal switch patients with type 2 diabetes are cured after the surgery and less complex than asatis. The pros here is up of 75% of excess of weight loss in the first year, less cutting and stapling, less risk of leaks, acid reflux, and nutrient deficiency, and can be revised to a gastric sleeve or mini bypass, RNY, or SATIs. The cons is a relatively new procedure. Lifelong bariatric vitamins and minerals are needed for supplementation. And here, the duration of this kind of procedure will take from approximately 4 hours, all right? And the recovery, it will take, it depends on what kind, from 3 to 6 weeks. Okay, now the duodenal switch surgery, or also called as bariatric diversion with duodenal switch. This is a powerful weight loss and metabolic surgery. This is one of the more complex surgeries in the weight loss. Here, the expectations are patients lose between 60 to 80% of the excess weight in the first year. It's a high percent of duodenal switch patients with type 2 are cured after the surgery. But here, a problem is the malnutrition with the DS. So it's very important in this kind of patients to have your vitamins and proteins, minerals, supplementations, to go with your physician for a follow-up. Here, the process up of 80% of the excess weight loss in the first year. The stomach size is reduced, high metabolic effect, and highest expected weight loss. The cons here is extremely strict vitamins required for life. The vitamins, proteins, minerals, checkups, and high risk than other bariatric procedures, obviously, because as you see here in this picture, on the right picture, it is one of the most complex surgeries. We need to make a sleeve and some connections with the small intestine. The duration here approximately is 3-4 hours. You will stay 3 nights at hospital, and the recovery will be from 3 to 6 weeks. Okay, here is these pictures. If you see the one of the left, you can see more connections over there and than the right one. So and on the right one, you can see the sleeve, you can see the like a mini bypass, and one of the on the left side, you can see a sleeve, you can see more connections on the small intestine, at least 2 connections. Obviously, these are one of the most complex surgeries. So it will depend on very specific characteristics of each patient. So we can make recommendations or approve this kind of surgery for you. On both of them are malabsorptive and restrictive procedures. So the weight loss and the abdominal or the gastrointestinal changes are be more than the other kind of procedure of the sleeve or a bypass. The revision surgeries. The revision surgeries are repairing, revising, or moving to another bariatric procedure. Lab band to a gastric sleeve, to a bypass or a SASI, or a gastric sleeve to a sleeve or a wide duodenal switch. A gastric bypass are more, or duodenal switch are more restrictive on the talking about the revision surgery, because if you already have a bypass, you already have connections inside. So here a bypass or a TOR A or a duodenal switch will be one kind of the options for you. Okay, even with the duodenal switch, we can make a revision for another changes in the connections or an ROI. So it will depend. It will depend of each condition or each previous procedure that you have. The expectation is to lose weight that was regained after a previous surgery, switch to surgery that is more effective and better for the patient, and resolve issues from the previous surgery. Some patients who have a sleeve and start regaining weight, or start with reflux, we can make a revision from a restrictive to a malabsorptive procedure. So with these options, obviously you can start losing weight again and resolve the GERD or the reflux. Obviously, risk of complications and longer recovery time. The hiatal hernia repair. The hiatal hernia occurs when a part of the stomach pushes through the diaphragm, often causing acid reflux or GERD. Surgeons typically fix the hernia at the same time as performing a gastric sleeve or a bypass. This helps prevent complications or a reflux, vomit, or even strangulation of the stomach. This is very common. This is very common to find a hiatal hernia. Some patients don't have any symptoms, but when we go in with the video, we saw it's very evident the hiatal hernia, and it's very important to fix it at the same time to reduce the stomach to the abdominal cavity and to put some sutures on that hole to prevent obviously that your stomach or your new stomach go through your thorax and can be worse in the future if we don't do that. The expectations is 1 in 3 bariatric patients has a hiatal hernia. So small hernias repairing during gastric sleeve, large hernias or GERD history, gastric bypass is preferred. Repairs are done laparoscopically through small incisions, and unrepaired hernias can cause serious issues after surgery. So that is why it's very important to repair during surgery. PCOS is other condition very frequently in some patients. The bariatric surgery is shown to improve and reverse metabolic syndromes in women with PCOS, reduce the symptoms and help restore normal ovulation. And numerous weight loss surgery patients of MBC with PCOS have been cured and overcome infertility. So how fast can the patients go back to work after a bariatric surgery? Obviously, it depends on what kind of activity you do. If you're in an office or sitting or a computer with a sleep, 1 to 2 weeks. If you're having a bypass or duodenal switch, it will take a little more time, from 2 to 4 weeks. If you are lifting, it will take more time, from 4 to 8 weeks. Obviously, it depends on what kind of activity you do. So we recommend now lifting at least for 4 weeks. Yes, the next, please. All right, here are one of the plastic surgeries or cosmetic that we have. Since the left facelift, maybe makeovers, breast augmentation, breast lifts, Brazilian butt lifts, liposuctions, arm and thigh lifts, and hysterectomy and endometriosis. And the gynecological options. There are some gynecological procedures that are now available here at Azar Hospital, including laparoscopic, hysterectomy, and surgery for endometriosis. If you have some kind of this condition, call your HQ and send to us. And obviously, we're having the orthopedic options like knee arthroscopy or hip arthroscopy or replacement.
Thank you very much, Dr. Montalvo. I take over from here. I mentioned this is Kelly, one of our affiliates. She's done bariatrics and plastic with us. So many success stories. I mean, that's a great thing about Facebook group, right? So our main Facebook group, as I mentioned, is private group only for past patients. If you want to know about inside of how it is to work with our surgeons, to get surgery with us, you go to Inside Mexico Bariatric Center. That's an inside. And that's the one you can join to feel how it is to be going through your journey with us. Our packages, as I mentioned, are very affordable. I mean, there are so many ways you can pay for it. And you know, it pays off in a very short time, and you prolong your life, of course, you know, you add years to your life, the quality of your life, everything changes. But if you need financing, these are the options. You know, you can look into personal loans with SoFi. We have several companies that we have issued on our website, Super Money, e-financing, and Medicard for Canadians. As far as the type of payments we accept, again, you can bring or send us a cashier check, but needs to be 2 weeks prior, so we know exactly how you're gonna pay. We take Zelle payments. Credit card has 5% charge, extra charge. We take FSA, HSA in some cases. And again, you know, you can get a loan against your 401k. One thing I want to mention is please make sure your payments are straightened out, because the last thing we want to worry about is your payment, because um, you know, we want to focus on your health and well-being and your surgery. We don't want to worry about all these side issues. Okay, so that's important to get that out of the way. MTI. This is a coverage you get for $99 only. $99 give you this kind of coverage. This is about $400 package that we managed to deal with the provider, which is Global Protective Solutions, to give us a volume discount rate. So we have reduced this to $99 for our patients. And that's one of the benefits you get with going with us. This is, by the way, is Natalie, which is our in-house nutritionist. Another subject that I keep pushing always is you need to take multivitamin bariatric, specific bariatric vitamins, which is Emerge, our brand. We co-branded with one of the top providers in this industry to offer the soft, chewable, drinkable capsule. It's very important. Some of them come with iron already in there. And again, you know, make sure you either get Emerge or however you get it, it has to be Emerge, you know, as long as it's good quality, sugar content is great. You need to take this to be successful so long term. So we're going to open right now for answering your questions. I've been answering some of them. So let's see. There are some going to be medical related that Dr. Montalvo is going to answer, and some is travel related that I'm going to be answering. So Dr. Montalvo, Chelsea is asking, what are the side effects beside weight loss most commonly associated with VSG? So Chelsea is asking, what are the side effects? Yeah.
Yes. Okay. About the side effects, there are not strictly like side effects. Obviously, we already talked, if there is a pre-existing GERD or reflux, can be worse. Is one of the it can be one of a common side effect. I think one is one of the common because other side effect, no, because with this kind of procedure, it's like learning again to eat. So you're going to start again with a small portions and knowing again to know knowing how to learn to eat again. But the pre-existing reflux is one of the common.
Okay, how is the pain after gastric sleeve? Is it painful?
It will depend. Some patients don't have any symptom. Other patients have moderate symptoms, but obviously we're going to put medication. So if you have some kind of pain or discomfort, to be the lowest. But no, most of the patients don't feel pain. Some patient is more discomfort for the gas.
Okay, so there were a couple questions about passport. We highly recommend passport, either passport book or a passport card. These days, it was during COVID, I'm sorry, that was hard to get passport. It would take a long time, but now it should be a big deal. You know, you just apply and get it. And there are some services that you can go through to get it faster. So yeah, but I highly recommend passport. Okay, they're asking about TOR procedure. Okay, like Dr. Montalvo mentioned, TOR is
It's an endoscopic procedure or alternative for patients who have a previous bariatric procedure. And with this kind of endoscopic procedure called TORE, we make a smaller pouch or even the anastomosis, and obviously the food go slowly again, and you can lose some weight with this kind of procedure.
yeah. So I'm just like I said, our website has a lot of information, a lot of procedures explained. So this is basically TOR procedure for revision of a bypass. You can go there, and as Dr. Montalvo mentioned, it just endoscopically, you just tighten the pouch if it's stretched. Okay, let's go back to more questions. Actually, they say, I don't know how much of my stomach was bypassed. That is why I'm looking at TOR procedure. I weigh 170 pounds. So basically, TOR is only tightening the pouch. They're not extending the bypass intestine. If you want that, you need to go to a full revision of a bypass. Okay, Nikki is asking, I had gastric sleeve in 2023. I'm 5'4", weight 320, diabetic control with metformin, high blood pressure, medication. What revision procedure would you recommend for me?
Obviously, a bypass, because you already have the restrictive procedure. So we need to make a change for a malabsorptive procedure. And obviously, the best option here will be a bypass.
Okay. Is dumping syndrome happening with the gastric sleeve?
No, because in the it's more common with the in the bypass and the sleeves, because this is related with the diet and the absorption of the of the some kind of food, not with the sleep.
All right, I'm going to go back to the slideshow. Okay. I have a gastric band and seeking revision to sleep. My doctor has advised against gastric bypass due to the calcium oxalate kidney stones, that it increases the chance of oxalate absorption. I've been told that scarring from the band might make a sleeve difficult. is it possible to undergo gastric band removal and do gastric sleeve conversion in one procedure? What are the risks involved?
Okay. Okay. If you I think this patient have the lap band.
Yes.
The lap band. Okay. You have both options. You have both options. Obviously, the kidney stones will be better with this change of diet. I think both options are good. Okay, but we need to see if these patients don't have any other medical conditions, the BMI and all that conditions. But both of them will be great.
Yeah, and then, usually, right, our surgeons are capable of taking the band out and do this conversion procedures in one surgery, but sometimes, could be a band can grow into the stomach or whatever else, so they may not be able to. So now you have to take the band out in one operation and come back a few months later and do the conversion. So there's always a chance, but they do everything they can to make it in one operation. Okay, they're asking you about the Hospital Azar. Hospital Azar has 40 beds. Only 4 rooms have double beds in case the patients come with their buddy companion, so they can be in the same room. But most of the rooms, almost all the rooms, are a single bed, which means there is one person only. Again, you have option to go in the room with another patient or your companion as a patient buddy, but that's how it is set up. What are the benefits and risks of not removing the gallbladder as other providers do so? Not sure what that means. So just talk about gallbladder removal.
Okay, if the patients have some gallbladder issues or stones on gallbladder, it will be very important to remove during surgery. If you don't have a previous gallbladder issues or stones or symptoms, why remove it? There's no indications to remove the gallbladder. So obviously, if you don't have some issues, you're going only to have more risk because it's another surgery. Is more risk of anything. So only the indications, the strictly indication is previous gallbladder issues or symptoms or gallstones. That's indication to remove the gallbladder.
So I just want to make something here, make a comment here that our surgeons don't remove gallbladder just to remove it. There's going to have to be indication to determine if it needs to be removed. So just make it clear. So what are the risks related to flying soon after the procedure? Again, if you have a long flight back home, you may want to consider staying 1, maybe 2 nights extra, and that can be arranged whether you want to stay in Tijuana or go back to San Diego and do that. So, and then these are the issues or things that you work with your coordinator. Every patient gets assigned to a coordinator, and that coordinator is your case manager They know you, they know your story, they know your history, and they've been working with you all along to the end. So you get special care and treatment from our coordinators. So whatever questions you have, you can bring it up with them. They'll be here to answer any question. Okay, so they want to know, is SASE better or is the same as VSG? What's the better option between SASE and VSG? You are on mute, Dr. Montalvo.
All right. Oh, sorry about that. Our different procedures. The BSG is a restrictive procedure. The SASI is a restrictive and malabsorptive procedure. So in the sleeve, there are only remove the 80% of the stomach. In the SASI, is remove the 80% of the stomach, perform a sleeve, and make a connection or anastomosis with the sleeve and the small intestine.
They say I use a CPAP machine. Should I bring it with me?
Yes, if the patients use a CPAP, it's very important to bring it with you. So because it's very important to use it after we finish the procedure and you're at recovery or at your room to start using. Maybe in a week, you're not going to need it anymore, but it's very important to bring it with you.
Okay, so two things they're asking. One is Precious is asking about the contradictions in having sleep when you get there. So remember, so the process is you submit a health questionnaire, our surgeon reviewed it, and they make a recommendation, they approve you for a certain surgery. You still go to Mexico in Tijuana, and you're gonna have a consultation with the doctor before surgery. So it's not like it's a done deal. Let's say the last moment you talk to Dr. Montalvo and he says, you know what, maybe we should do bypass or mini bypass, not go sleep. We would change that procedure that fits you best. And this is a benefit going with us because we're not limited to the BMI or the procedure. We can do whatever is best for you. At the end of the day, you get what is best for you. For us, it doesn't matter. We want to give what is going to work for you. So don't worry about that, and then of course, if there are, let's say if you're signed up for bypass and you get sleeve, we refund you the difference. So it's not like, so there's no like, don't worry about that, okay? You still have time when you go there. They take time to take care of you. About medications. Okay, so our all-inclusive packages has pre-op and post-op, of course, during your stay, medication package. There are some patients, let's say if you have certain type of conditions that, comes with obesity too. So you may need some extra pain medication or nausea medication out of the package. So at the end, they charge you if you needed something beside the standard package. And usually, I would say if you need it, is averaging between maybe $20, $30. Because we pretty much pass the same savings we get as a whole sale market, and we pass it on to you. It's not like you get charged $500 for one medication. So it's very inexpensive. If you need more medication, we give it to you almost like a discounted, and you just get charged, okay? But most people don't need it because they are okay with the standard package. Yeah, as I mentioned, there is a Mexico Bariatric Center support group. Well, okay, so there's Mexico Bariatric on Facebook. Inside Mexico Bariatric Center, which is the one that you can jump in to see how it feels to be a patient with us, and Mexico Bariatric Support Group. That's the one that is private, only for our past patient. Okay, another benefit going with us, we do your FMLA paperwork for you. So help you do your time off from your work. Okay, we did talk about, let me go back here. I just want to go back to the slide when we talked about cosmetics, because there are some question about that. Our cosmetic program is extensive. We do have board certified plastic surgeons. Of course, we don't use usually the same plastic surgeon for face and body contouring. They're all specialized in their own area. And not only that, they have experience and they have a specialty in dealing with post-bariatric patients. Post-bariatric patients are special. And actually, something else I need to mention here is if you are a revisional surgery, please do a blood test before you come, because that blood test show your hemoglobin level. And if you need to bring it up to past 12, at least has to be 12 or more, you need to take care of it before you come. So when you come there, if we see you have that problem, then we have to do a blood transfusion, which is not a big deal, but it's better to know before you come and you take care of it, especially for plastic patients. So if you had prior bariatric surgery, it's important to know your hemoglobin level, whether you come for bariatric or plastics. Now, like I mentioned, we do offer anything from a what we call mini facelift to a full facelift to nose surgery to tummy tuck, whether it's butterfly, circular. Mummy makeover is basically a bunch of procedures in one operation, and anything from breast to arm lift to thigh lift. And we said we are offering hysterectomy also. Okay, is it safe to have surgery if I have asthma?
Yes, if you're under control and you have your medications, yes, there's no problems. All of our anesthesiologists uh, have very um, um, specialists with this kind of medical conditions. Obviously, they are the experts in the cardio and pulmonary or lungs issues. So no problem. Well, a lot of operations have kinds of asthma or allergies. And then the obviously we will it's very important the the duration of the procedure. So we have all the or they have all the medications required for you in some special cases. So don't worry about that kind of medical conditions.
Okay, they're asking about hernia. I think that hernia repair is about $400, but I don't want to say that. And I think it's $395, but I'm not quite sure. Again, everything we do is very affordable. And this is a great option that the surgeon looks for hernia if it needs to be repaired during the surgery, because that saves you from having side effects after surgery and have to do another surgery just to fix that. but the surgeons look for hernia to see if it needs to be repaired. If you already know you have it, of course you put it in your health questionnaire and we would schedule for that. But even if you don't know, that's part of the problem, that people have reflux, right? So the surgeon can fix that. Let's say we gastric sleeve and you won't have reflux anymore, and you saved another going through the anesthesiologist and getting, going, putting down, paying for another surgery. Again, it's a great thing that we do. Yeah, Kate is mentioning about Emerge Bariatrics vitamin. Emerge is made based on the ASMBS standards or requirement for post-bariatric patients. And the ingredient is the best, the sugar content, everything is the best. And unfortunately, years ago, we used to pay, I don't know, something like $40, $50 to send it to Canada, which was still affordable. But right now, it's hundreds of dollars to ship anything. And we just unfortunately can't provide this to Canada. I mean, one option that we've been looking for, of course, remember, we only opened the hospital 9 months ago, and we are trying to see if we can provide you the option to purchase it when you're down there and take it with you. So that would be one option, but we are working on that, believe me, to get that to you guys, even if you can carry it with you to your homeland. So they're asking, is it better to drink sugar drink or artificial sweeteners after surgery? What's the best artificial sweetener to look for? Sometimes I buy like Kool-Aid or some puddings or gelatin and add my own sweetener. So they're asking about what's the best sweetener after bariatric surgery.
Okay, here, talking about the better sweetener, it will be the one is the zero or the 0 calories, because some patients don't like one or another sweetener. But it will that you prefer, the best is zero. Is zero. Zero Gatorade or Powerade or but not specific sweetener.
Okay, Jenny is asking about complication rates. So the published data in US and other journals, if you look, is 2.5 or some number like that for complication rate of weight loss surgery. Our complication rate is that 1%, less than 1%. And most of the time, it's detected when you're down there. I would say maybe bleeding, and that we do a reintervention, and that's why the MTI is great, right? If that happens, you have the coverage. Of course, we don't refuse to give you surgery. The minute something happens, the surgeons, the staff are right there taking care of you. So no worries. But that's the complication we talk. And then again, it's important for you to do a good job on pre-op. It's important for you to do a good job on the post-op. And, with the diet, with lifting, we talked about it. Don't lift anything heavy on the way back. Like even your suitcase, don't try to put the suitcase above the compartment in your in the plane. Maybe get somebody to help you. Okay, so these are important, not to stretch yourself. And then go with the post-op recovery that Dr. Montalvo mentioned, like when to start swimming, when to start running. Give yourself time, give your body to heal. Don't go to the gym and lift heavy weight. You can do walk. Walk is great, things like that to give yourself time to recover. And then something else about complications is like some I've seen some surgeons or some company, they said we have zero complications. And if a surgeon or a company told you they have zero complications, you run away because they're not telling you the truth, right? It's our bodies, this is a surgery. Yeah, we've got it down to science, but still you don't know how your body is going to react to things, right? Things happen. So anyway, so I don't know, like you may want to bring, we always take credit card, of course, for extra fees, anything that happens down there. But if you want to bring cash, I don't know, bring some cash with you in case you need it. Okay, so the blood test that I mentioned is best to do before your travel. It's just a regular blood test to show your hemoglobin level and things like that. And after the procedure, you may want to go, not you may want to, go to your general physician 3 months out. They do a blood test, make sure your vitamins are all good, everything is good. And then after that, just do a regular checkups, okay? I think the price of ESG is about $5,000, more or less. We have reduced it recently. Yes, we do have facilities in Monterrey. Reach out to your coordinator and have them talk to me because we have one of the best surgeons in Monterrey that we work with, okay? It is very important for you guys to be mindful of caffeine before and after, okay? And smoking. I don't know if I mentioned. It's hard to stop and not do it, but it's very important for your pre-op and post-op for your better recovery, please. Okay, if you have any allergic reaction to anesthesia, that's something you need to talk to Dr. Montalvo and his team when you get down there. Of course, it's better to put it in your health questionnaire, and they make sure that you be fine when they put you down. Okay, so no worries there. I know, for example, Dr. Montalvo's anesthesiologist is one of the best. So you're in good hands, okay? Okay, let me take a look at the time. We're almost at the 2-hour mark. I'm sorry, we have about, my God, we have almost 90 some more questions. Again, accept my apologies. We cannot take this down more because, some people have to leave. We want to do the raffle. So we are going to announce the raffle winner. And then if any question that you have not answered, please reach back out to us, and we'll be more than happy to answer. Again, Dr. Montalvo is going to be live. When is the last time you were live, Dr. Montalvo, on Wednesday? When was the
I think it
last
was
one?
like 2 weeks ago.
Okay, maybe it's your turn to go back, but there is one surgeon available always at 10 a.m. Pacific Standard Time. You can jump in there, ask the same questions. They'll be more than happy to help you. But so this is the, okay, let me, all right. Okay, the winner is Kimberly Williams. Kimberly Williams is our winner. I'm gonna let you talk and tell your story, share whatever you want to share with us. You still, yeah, there you go. You can unmute yourself, Kimberly, and talk to us. Tell us where you're from. And there you go. Oh, shoot. I'm sorry. Okay, there you go. Hi, Kimberly. How are
Hi,
you?
how are you? Can you hear me?
Yes, I hear you. We hear you. Go ahead.
Okay.
Where are you from?
I live Nacogdoches, Texas. I live in Texas. I'm
All
like
right.
maybe 2 hours from Houston.
Okay. Well,
Yes.
I want to congratulate you from my
Thank you so
side and Dr.
much.
Montalvo. You were the lucky winner. Of course, everybody who gets this surgery is lucky because
Oh
you're
yeah.
changing your life. But tell us about yourself. Tell me,
Oh,
you want to tell, do you have your age or like your conditions or your
okay.
BMI?
Well, I'm 41. I'll be 42 in September, and I have 4 children. I had 4 C-sections, and I always had like a little issue with my weight. It fluctuates up and down, and I used to take steroids as a child growing up. I do every once in a while. I do now because of my asthma. I have asthma, so like I've gained weight from that too. And I've had tried different diets. Sometimes that'll work a little bit, but I gained the weight back. So I started looking into having surgery, and then I found y'all on online and on Facebook.
Great. It's so good that you are doing this when you're younger and you have more energy with your kids. It's a whole
Oh yes,
different,
sir.
yeah. And by the way, um, I forgot to mention Kelly, one of our affiliates, is coming in August to take her sister. So people around Kelly can take advantage going with her. But anyway, we would be in contact with you, Kimberly, and get you scheduled so you
Okay.
can take advantage of this situation. And thank you, Dr. Montalvo. Thank you for everyone else that joined us.
Thank you.
We are very glad that you took time and very honored actually. And we will be looking forward to have another webinar soon. Okay, thank you guys. Appreciate it and have a great weekend.